Joint pain is a common problem for many seniors, whether it's due to arthritis, injury, or simply the natural aging process. It can make everyday tasks like walking, climbing stairs, or even getting out of bed a painful struggle. While managing joint pain often involves exercise, physical therapy, and medications, one factor that many people overlook is diet. Did you know that certain foods in your diet could actually be making your joint pain worse? While these foods might seem harmless or even healthy, they can contribute to inflammation and pain in the joints, making it harder to stay active and manage your condition. In today's video, we'll take a closer look at 5 common foods that could be aggravating your joint pain. Understanding how these foods affect your body can help you make better choices for your health and your joints. Let's dive into these foods and why you should consider reducing or eliminating them from your diet. 1. Sugar. The first food on our list is sugar. It's no secret that sugar can contribute to weight gain, but many people don't realize just how much it can worsen joint pain. Excessive sugar in the diet triggers the release of inflammatory molecules known as cytokines. These molecules can cause inflammation in the joints, leading to more pain, stiffness, and swelling. For seniors with arthritis or other joint conditions, sugar can be especially problematic. Sugar can also cause an increase in the production of advanced glycation end products, 𝐬𝐵s, which are compounds that can directly damage collagen in the joints. This damage makes the joints less flexible and more prone to pain and stiffness. In addition, consuming too much sugar can lead to weight gain, which puts extra stress on the joints, particularly weight-bearing ones like the knees and hips. This added pressure can increase pain and accelerate the wear and tear on your joints. To help reduce joint pain, try cutting back on sugary foods and drinks, such as sodas, baked goods, candy, and processed snacks. Instead, focus on natural sources of sweetness, like fresh fruits, and consider reducing your overall sugar intake to improve joint health and manage pain. 2. Processed foods. Processed foods are another culprit that can worsen joint pain. These foods, which include packaged snacks, fast food, and prepackaged meals, are often loaded with unhealthy fats, sodium, and artificial additives. These ingredients can contribute to inflammation in the body, which exacerbates joint pain. One of the biggest issues with processed foods is their high content of trans fats and refined oils, such as soybean or corn oil. These unhealthy fats can increase inflammation and cause oxidative stress, leading to damage in the joints. Additionally, the high sodium content in processed foods can cause fluid retention and swelling in the body, which can worsen joint pain, especially in conditions like osteoarthritis. For seniors looking to manage joint pain, it's best to avoid or limit the intake of processed foods. Instead, focus on whole, unprocessed foods, such as fresh vegetables, lean proteins, and healthy fats from sources like olive oil, avocados, and nuts. These foods provide essential nutrients that support joint health without the harmful effects of processed ingredients. 3. Red meat. Red meat, such as beef, lamb, and pork, is known for its high protein content, but it can also contribute to inflammation and worsen joint pain, especially when consumed in large quantities. Red meat contains a type of fat known as saturated fat, which has been shown to promote inflammation in the body. For seniors with joint pain or arthritis, this inflammation can increase pain and swelling in the joints. Additionally, red meat contains compounds called purines, which can increase uric acid levels in the blood. High levels of uric acid can contribute to gout, a form of arthritis that causes severe pain, especially in the joints of the feet and toes. If you already suffer from gout or are prone to it, red meat can make your symptoms worse. To reduce joint pain, try cutting back on red meat and opting for leaner protein sources like chicken, turkey, or plant-based proteins like beans, lentils, and tofu. These alternatives provide the protein your body needs without the inflammatory effects of red meat. 4. Dairy products. Dairy products, including milk, cheese, and yogurt, are often considered essential for bone health because they are rich in calcium and vitamin D. However, for some seniors, dairy can actually worsen joint pain. Dairy contains a protein called casein, which has been shown to increase inflammation in certain individuals, particularly those who have sensitivities to dairy. In addition, many dairy products contain saturated fats, which, as mentioned earlier, contribute to inflammation in the body. This can worsen symptoms of joint pain, particularly for those with conditions like rheumatoid arthritis or osteoarthritis. If you suspect that dairy may be contributing to your joint pain, consider reducing your intake or switching to dairy alternatives like almond milk, soy milk, or oat milk. These alternatives are often lower in fat and are less likely to trigger inflammation in the body. Look for fortified dairy alternatives that provide the same benefits as dairy, such as calcium and vitamin D, without the negative effects on your joints. 5. Nightshade vegetables. Nightshade vegetables, which include tomatoes, peppers, eggplants, and potatoes, are commonly included in many diets and are packed with nutrients. However, for some individuals, these vegetables can trigger or worsen joint pain. Nightshades contain a chemical compound called solanine, which has been shown to contribute to inflammation in the body. While the exact impact of solanine on joint pain varies from person to person, some people with arthritis or joint conditions report that consuming nightshade vegetables can lead to increased pain and stiffness in their joints. If you're experiencing joint pain, it may be helpful to try eliminating nightshade vegetables from your diet for a few weeks to see if your symptoms improve. If you notice a reduction in pain and swelling, you may have a sensitivity to nightshades. Instead, focus on other nutrient-rich vegetables like leafy greens, carrots, and cruciferous vegetables like broccoli and cauliflower, which have anti-inflammatory properties and are less likely to cause joint pain. Conclusion: joint pain can be debilitating, but your diet plays a significant role in managing and reducing that pain. By understanding the impact of certain foods on your joints, you can make better choices to help reduce inflammation, protect your cartilage, and support overall joint health. Reducing or eliminating foods like sugar, processed foods, red meat, dairy, and nightshade vegetables can make a big difference in how your joints feel. Instead, focus on eating anti-inflammatory foods such as fruits, vegetables, lean proteins, whole grains, and healthy fats. These foods nourish your body and can help keep your joints functioning properly. If you're unsure about which foods may be causing your joint pain, consider working with a healthcare provider or a nutritionist to develop a diet plan that supports joint health. They can help you identify any food sensitivities or intolerances and recommend supplements or other treatments that may benefit you. Thank you for watching. If you found this video helpful, be sure to like, share, and subscribe for more health tips. Stay healthy, stay active, and take care of those joints.